Welcome to the Perry Health Pulse podcast, a program dedicated to taking you behind the scenes of healthcare, sharing firsthand knowledge from healthcare professionals, and putting you in the driver's seat on your journey to lifelong health and wellness. Listen and learn about how healthcare delivery is changing on our weekly podcast.
We're joined today by Courtney Engel. She's been on the show before to talk about stroke and stroke recovery. Today, she's here to talk about fall prevention. Courtney's been an occupational therapist for 13 years and serves patients in Perry's Medical Rehab Department. Welcome, Courtney.
Thank you.
All right, so we're talking about falls today. All the time I hear talk about falls and what we're doing to prevent falls, and why is it that falls are such a big deal?
Falls are actually the biggest leading cause of fatal and non-fatal injuries for people 65 and older. Falls are not normal, and they are very preventable. They are just the leading cause of injuries at this time for 65 and older.
Just to paint that picture for people, what are some of the stats related to falls?
Actually, 1 in 4 older Americans fall every year. Each year, there's 3 million older people are treated in the emergency departments alone for fall injuries. There's also many other stats regarding the results of falls. Like there's over 90% of all hip fractures are caused by falls. Over 800,000 patients a year are hospitalized because of a fall injury, most often actually related because of a head injury or a hip fracture. Related to the hospital, over half of the older adults that are discharged for a fall-related hip fracture will fall again within 6 months. Over 40% of nursing home admissions are the result of a fall-related injury. And then 40% admitted to a nursing home never return to independent living again. And that's scary to think about, that one simple mistake or one loss of balance will change your life completely. And that's not normal. There's ways to prevent that for sure. That's just outrageous to think of, when falls could be 100% preventable. And it is not a normal way of life. People may think when they get older, like falls are normal, but they are not normal in the aging process. So please be proactive, exercise, see your doctors on a regular basis, and prevent these falls. And the sad thing is, a lot of the older population, they think it's okay. Like, oh, I fell, I didn't get hurt. Well, you may not have gotten hurt that time, but every time you fall, you're increasing your risk each time. And one fall could lead to a hospitalization, then to a nursing home, and then you're not going to go back home ever again. It changes your life. There's 7 fall deaths every hour by 2030. That's what they're anticipating. But related to any falls, like it can lead to death.
Well, yeah, 40% in nursing homes, and then you said 800,000 patients are hospitalized from it. That's a very significant number, and I think a lot of people take for granted, going about their lives and not worrying about falling when they could be taking steps to prevent it. What are some things that can be done to prevent falls?
Well, there's a lot. Let's talk specific, if you're in public, or if you're in public at a store, just out and about. Number one thing is to be aware of your surroundings. Watching the different levels in the pavement, looking for curbs, being aware of grass versus gravel, and so forth. Also, climate changes, the wet surfaces plays a really big role. And I like to say, when there's any sort of wet surfaces out and about, you need to walk like a duck. Like at home, you could remove rugs and cords, declutter your home, including as simple as even furniture, like a coffee table. They could get in your way. Slips and falls happen year-round, but unfortunately, these incidences of falls increase during winter and spring months when there's thawing and freezing occurring. Just the outdoor walking services and any weather conditions such as ice and snow just are the most common reasons.
Are there other factors that lead to high risks of falling?
Yes, your health condition or chronic conditions play a role. And as you progressively weaken as you get older, if you don't do any exercise, you do just naturally weaken as you get older, and that plays a factor in your chance of falling. Also, medications play a role, the type of medication you're taking, as well as how they're prescribed to you, or even if you're taking them as prescribed, makes a big difference. Your vision plays a role in your fall factor. The lower the vision you have, the increase of risk you have. It impairs just the lighting. It impairs your depth perception and your abilities just to see contrasts, environmental changes related to the weather, curbs, uneven surfaces. So there's many things that you could do to be proactive for yourself, and that is to stay up to date and see your provider often, to stay on top of your health conditions, your medications, as well as being active, like exercising, going to physical therapy, getting out and walking, or getting a program for yourself that fits you well. We offer here at Perry Memorial Tai Chi, which really helps improve your coordination and your strength and your balance. And I highly recommend that. Strengthening your body, your muscles, will decrease your fall risk.
Well, and we did an episode about the Tai Chi program with Doreen, so I'll link to that in this episode's page.
Yes, it's offered twice a week, so pay attention to that. That would be wonderful to do.
Let's pause for just a moment to hear a word from our sponsor. Today's episode is sponsored by Perry Home Care.
Imagine being able to recover from an illness or an injury in the comfort of your own home. Perry Memorial Hospital now offers professional care from our door to yours. Perry Home Care provides skilled nursing, medical rehabilitation, and education for a safe and comfortable recovery. To learn more, visit perrymemorial.org/homecare. We listen, we care, we are Perry.
Well, so let's say that you're about to fall. It's going to happen. You're on the way down. Are there safe ways to fall?
It's kind of funny to think that there's actually a safe way to fall, but there is. Just staying loose, staying bent when you go to fall makes your landing softer when you stay bent. If you're like rigid and your arms are out, your legs are straight, you're at risk of just more injury at that time. The impact is a little bit harder, whether if you stay bent. You also want to make sure you protect your head when you fall, which is probably the last thing you think of when you go to fall. But typically tucking your head when you do go to fall will help possibly prevent it from slamming up against the ground or hitting it on something as you go down. Also, landing on the meat. You have more muscles in certain areas of your body than others, and you want to land on those cushioned areas instead of like an outreached arm where you could break your wrist or something like that. Try and land on the meat is what they say. They also say as you fall, you just keep falling, allow it, fall into it. And your instinct will be to stop your body as quickly as you can. But your safest route is just to keep rolling, keep going as you need to.
Let the momentum dissipate.
Yeah, absolutely.
So what happens if you fall and you can't get up? What should people do then?
Well, I like to set up preventable options for you first, and that's if you live alone, get Lifeline. Even if you don't live alone, there's chances are that you'll be alone at some point. Get Lifeline or some sort of a life service that you could call easily for help. And they usually is a wrist bracelet or around the neck necklace, and you could use that. If you do fall, crawling to the nearest phone is going to be your best bet. There's some cases that you can't crawl to the nearest phone. So I would have someone checking on you on a regular basis, daily, twice a day, whatever it might be.
So you mentioned Tai Chi, but what other things are done here at Perry to help patients who have fall risks?
We do offer physical and occupational therapy at an outpatient level, and you could just get an order from your provider saying you think your balance is a little off or you just feel a little weak, and you could come in to be evaluated, and you could either come for weekly services to strengthen and work on your balance, or we could set you up with a program for you to do it on your own at home. We also do free balance screens. So if you feel like your balance is off just a little bit, you just call to schedule. I think it's a quick appointment, and the physical therapist will do some balance testing on you and determine if you need some further assistance or if you're okay, and suggest help at that point.
Well, and then lastly, I want to ask you about the low vision support group that's coming up on September 19th, because you're actually going to be talking about this topic. Can you tell the listeners a little bit about what that's going to be?
Yes, I'm going to have roughly an hour meeting with anybody that wants to come. It's a little bit more focused on low vision and how to prevent falls with someone with low vision, but also with a caregiver that takes care of people with low vision. And I also would like to talk to them about safe ways to fall. Once again, like if you have time to think about it, you just fall and roll with it, fall into it, and stay bent, and teach them they need their caregivers with them, and check for uneven surfaces outside. There's kind of a lot to go over, and I'm going to go over a lot of stats with them as well, and hopefully kind of promote some exercise. You could still exercise with low vision. And the specific thing about Tai Chi, if you have poor balance in the first place, you could do Tai Chi in sitting. That's the number one step. You do it in sitting, and then we will progress you to standing. So same with physical therapy and exercise. If you haven't exercised in 30 years, well, there's a starting point for everybody, and we are there to help you and guide you.
Yeah, there you have it. They're here to help and guide you. Low Vision Support Group is Thursday, September 19th at 1 p.m. If you or anybody you know is struggling with vision issues and could benefit from this, it's a completely free event. And then overall, just thinking about falls and how to prevent them, and for both yourself and people that you know, make sure that it's not considered a normal activity. Thanks so much for the information, Courtney. It was great.
You're welcome.
It doesn't stop here. Access other podcast episodes and resources related to today's episode by visiting www.perrymemorial.org/podcast.